Good day, my name is Dheeraj Harrier. I'm Sonia's husband. The reason why we came to India is because Sonia had a problem with a pinched nerve in her lower spine. She found out through a Canadian from Quebec City, actually from Trois-Rivières, who had the same problem, but his was for years. After some research, he ended up on the foreigners' healthcare system here in India. He got in touch with Dr. Bojwani, and he finally ended up here a few months after to get an operation. Three days after, he could walk, like anything happened before. So when Sonia heard on the radio that this gentleman had an operation here, she got in touch with him, and he get in touch with Dr. Bojwani and the foreigners' healthcare, and all together they exchange the MRA, exchange her pills she was taking, exchange her doctor notes, and Dr. Bojwani concluded that he can actually perform an operation on Sonia and fix her up. So therefore, about 4 weeks after it all started, we ended up in India. We were picked up at the airport from one of the Dr. Bojwani staff, conducted here at the hospital, and at the hospital, even though it was about 2 o'clock in the morning, there was one assistant from Dr. Bojwani waiting for us and to go over Sonia's medical paper. The operation took place 2 days after we came up here. Meanwhile, the first day she had another MRA done on her. She had an ECG, plus she was given different pills and blood test. So the day after, the second day, she was actually conducted to the operation room early in the morning at 8 o'clock. 2 hours after, she left the operation room and she was fixed up. One of the funniest thing actually was the doctor showed up 45 minutes after, came to the room here and asked her to stand up and start walking. She did. It was very amazing to see that she had no pain, even though she just got operated. So she's been in bed for the last day and a half now to recover. The pains are gone. She's doing very well. I would like to talk about the nurse. The nurses here in India are extremely good. They're always coming up, and double checking, triple checking on her. They take her pressure, they take her pulse. They're doing a very, very excellent job. As for the room, you probably would like to know. The room are great. This is a Class A room. It's perfect for the patient. The food seems to be excellent, and plenty. We get 3 meals a day. And as for the reminders, the service personnel, by the way, are also doing a great and a fine job. They come at least 3 to 4 days just to clean up the room. So the cleanliness of the place, nothing to say. But altogether, we're very, very, very pleased with the staff and Dr. Bojwani, and the foreigners' exchange care, the way we are treated. I'm very pleased, and I recommend, please do not suffer for any reason, if you have a back pain, regardless of which country where you live. Take your time, check on the internet, and we'll be pleased to answer all your questions.